Good morning, everyone, and welcome to today's webinar. Today we'll be talking about brain health. Your presenter is Andrea Salmon, and my name is Annie Sasson, and I will be your facilitator. We begin all our programs with an acknowledgement. We acknowledge and pay respect to the traditional custodians, past and present, on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Okay, I'd now like to introduce you to Andrea Salmon, who is our presenter today. So Andrea is one of the Education and Wellbeing Program Coordinators here at MS. She started here at MS as an occupational therapist many years ago and has held various roles since then. Andrea believes that knowledge is power and wants people living with multiple sclerosis to feel supported and empowered to make informed decisions regarding living well with MS. In her current position, she is able to combine clinical experience and educational philosophy to provide quality experiences for people living with MS, their friends and family through webinars and face-to-face wellbeing programs. So a big warm welcome to you, Andrea. Thanks for being with us today.
Oh, well,
I'll hand over to you now.
That's great. Great to be here, and great to be able to present some information about brain health in a webinar format. We've been using this material for a little while, well, the last probably 6 months in our wellness lunches. So we thought maybe we should be also presenting it as a webinar. The information that we'll be talking through today comes from a recent publication on brain health that was the result of a worldwide collaboration, including Australia's own Helmut Bootschoven, a professor of neurology, who some of you, if you're in Melbourne, might know. The MS Brain Health was presented at various MS meetings and conferences over the last 12 months or 2 years, actually probably getting a bit more than that. And it has been put together, and I'll use the words radical. It's calling for a radical change in the management of MS, because the people that have put it together have seen that time matters at every stage of diagnosis and treatment. So what we're going to be presenting today are tips to help you live a brain healthy lifestyle. Hence why we thought the best handout was actually the booklet rather than just the slides that we're going to present, because what you'll notice is that the information that we're presenting is probably things you're already aware of. And if I'm truly honest, it's not particularly new. What's different about the way they've put this material together is that it's looking at a proactive way that people can keep their brains healthy, and it really applies to the whole population, but more importantly when you've been diagnosed with a condition like multiple sclerosis, that is a disease of the brain. We want to be really thinking about what are we doing to help keep our brains healthy. So first off, they talk about the key strategy being minimizing relapse and eliminating inflammation. The goal of treating and managing MS is to prevent new lesions and to prevent brain atrophy at all stages of the disease. So this strongly sits with your medical team. The neurologists, your GP, these are the people who you want actively involved in helping manage the disease process. Long-term research studies and real-world evidence from a whole range of databases and registries have shown that early intervention with disease-modifying therapies leads to better outcomes in people with both clinically isolated syndrome and relapsing remitting MS than those who delay treatment. Now, I also acknowledge that we can't change the past, but we can take a bit more control going forward. So if you're, depending on where you are in your journey with living with MS, you might be at the early diagnosis phase where that piece of information becomes really crucial, but you might have been diagnosed many years ago. So a brain healthy lifestyle is still something that you can aim to live. So what makes up a brain healthy lifestyle? The brain health guidelines state that in addition to the early treatment of MS, the following principles are going to help us keep our brain healthy. So keep as active as you can. Keep your brain active. Keep your weight under control. Avoid smoking. Watch how much you drink in terms of alcohol. Continue with other medications that your doctor has prescribed. Avoid stress, or at least minimise it. Reorganise your life priorities and find your support team. So that's what we're going to talk about today. So as I said, probably not anything you might not have been aware of before. But the challenge is, how do I make sure I'm actually giving these areas of life and lifestyle the proper attention to help keep my brain healthy? Let's have a look at exercise. Exercising regularly is one of the greatest gifts that you can give your brain. As you run, pedal, or twist your body, even in yoga, and no matter what the exercise is, your breathing rates change, you boost your neurotransmitters, and you protect your brain. Higher levels of aerobic fitness are associated with faster information processing and the preservation of brain tissue volume. Many of the symptoms associated with MS can be reduced through physical exercise. There's a whole lot of research that you can read to support that. And advice on exercise is the most commonly unmet need for people with MS. So here's some evidence-based advice. 80% of people with MS are inactive. So if you fall into that category, we need to get you more active. Exercise doesn't make fatigue worse, it actually improves it. And I know that's hard to believe, but it's true. Exercise has a positive effect on the brain and can improve or maintain brain volume. And that's really key when we know that people with MS lose brain volume at a higher rate than the general population. Higher heart rates result in more brain-derived neurotropic factor. Now that sounds like I know what I'm talking about, but it promotes the survival of nerve cells in the brain. It helps neurons remain vigorous and it strengthens the connections, boosting learning and memory. Lower levels of that same brain-derived neurotropic factor are associated with cognitive decline. So we want to keep you active. You should want to keep active and as active as you can, depending on your situation. It's normal to feel some sensory changes during exercise. When you're exercising and your core temperature goes up, you might experience some increase of symptoms, but they shouldn't last too long. They should recover as you recover from the exercise. If those changes of symptoms last longer than 2 hours, it might be too much and you might need to bring it back. But we would encourage you to get some advice. Check out a physio or an exercise physiologist. Talk to someone who can guide you on the right forms of exercise. Check out all the information on our website. There's lots of information there about exercising in MS. You also need to keep your mind active. Learning, reading, hobbies, or artistic or creative pastimes can help protect your brain against cognitive problems in MS when you pursue them over a long time. There's 3 cardinal rules. Try something new is number 1. So try new experiences outside your comfort zone. If you normally read, try painting. If you don't cook, maybe start cooking. If you've learnt an instrument like the piano, maybe you take on a different instrument. So try something new. Number 2, challenge yourself. Keep increasing the level of difficulty. You might be great at Sudokus or crosswords. Fantastic. But you need to step that up and move into something that's more difficult for you, so your brain's having to work differently or harder. And the third cardinal rule is create variety. You will benefit most from variety. So vary your cognitive workout. Go and see a play, go and watch a movie, visit a museum, take music lessons, play cards, mix it up a bit. These can be great things, ideas to share with each other as well. If you find something really useful and you're part of a support group or an online group, share the ideas. Find someone to go with you and do it so that it makes it more interesting by doing it together. If you're working, I'd just double check that you know about our employment support service, because that's a fabulous program to help people remain in work or look for work. And employment can be a great way of keeping our mind active. But it doesn't have to be around employment. It's all the other things we do as well that keep our mind active, challenge us, keep us using different parts of our brain. The advice is to keep our weight under control. There's strong evidence that increased body weight and obesity is associated with a higher number of MS lesions. That in itself should be a red flag for you. There are a number of diets or protocols out there, and that can make this area really confusing to navigate. Not all of those protocols are based on peer-reviewed research. This area, it continues to be of interest, but it needs a lot more research. So it's best to find out what works for you and have an individualised and open-minded approach. You can ask to be referred to a dietitian, maybe a dietitian that specialises in MS if you need professional support and advice. But ideal weight is what you're after, and that depends on your height and gender as well. So it's not about particularly following a specific diet, it's keeping your weight under control in the best way that works for you. You can check out our Eat Well, Live Well information on the MS website, and that helps with some individual advice and a bit of a guideline that can be created for you because of a few questions that you answer in that online tool. You can do it on your phone as well. There's a lot of new information emerging all the time. In September of last year, MSRA, in part of their research, found that higher fish consumption was linked with a lower risk of central nervous system demyelination. So that's a good piece of advice. Increase your fish intake. And this research, it was funded by MSRA, and this research showed that a higher fish consumption was actually 2 serves a week. So increasing to 2 serves is associated with an 18% reduced risk of a first clinical diagnosis of demyelination. So it doesn't hurt to increase your fish consumption. There was also some research done through the Autoimmune group, and that showed a link between non-processed red meat and lower MS. So simple red meat, steak, things that aren't processed. And a plant-based diet, emphasising fruit, vegetables, nuts and legumes, has also been shown to be useful in reducing the risk of Alzheimer's. So, you know, if we're thinking about a mind diet, we want to be thinking about making sure we get the right balance of lots of leafy greens, lots of fresh fruit, lots of vegetables. Reducing, it's very much the healthy eating pyramid.
And we just had a question come through from Zalika, and I hope I pronounced your name correctly, Zalika. The question is there any particular food or supplement that people living with MS should avoid altogether?
Not that I'm aware. Okay. Healthy, well-balanced diet.
All right, fantastic. Thanks, Andrea.
There might be other reasons why for a particular person, they might need to consider what foods they avoid. That could be related to other things that you're also living with. But in regard to MS, purely and simply, no need to avoid anything. But we do want you to avoid smoking. Smoking is associated with decreased brain volume in people with MS, and it's also been associated with higher relapse rates, increased disability progression, more cognitive problems, and reduced survival compared to not smoking at all. So for people who already have MS, there's good evidence that stopping smoking reduces the risk of disability progression. Smoking is known to cause an increase in inflammation, and chemicals in smoke can also directly alter the function of some immune cells, and that has the potential to contribute to even the development of MS. So if you smoke, maybe there's another prompt to try quitting. You might have tried before, but try again. If you can quit smoking, it will be well and truly better for your not only general health, but your MS disease health as well. Check out things like quit campaigns, speak to your GP about programs, get some support. We know it's not easy, but it's really important to consider.
Andrea, Rashmi has typed in, how about passive smoking? I know that's something we should avoid as well.
Well, hence that statement about the chemicals in smoke can also directly alter the function of some immune cells. These days, we can largely in public places avoid passive smoking, but if you've got someone in your household who smokes, that can be really hard to avoid passive smoke. But yes, try to avoid it.
Absolutely. All right.
And also, she says, taking a sip of tea, watch how much you drink. Now, this is actually related more to alcohol. Higher levels of alcohol are also associated with disability progression in MS. But in line with a healthy, well-balanced diet, alcohol consumption needs to be in moderation. So again, it's just that prompt to think about how much are you drinking and is that too much? The flip side is when it comes to water, we want you to be aiming for up to 2 litres of water a day. Water is fantastic. It helps prevent dehydration, which can add to fatigue levels. It's great for your bladder, great for your bowel. So make sure you're drinking water. Just be conscious of how much alcohol you're drinking. Manage stress. It's a great suggestion, really, isn't it, for brain health? Not always the easiest thing to achieve, but we want you to consider managing stress. MS by itself can be stressful. However, studies have linked severe stress with an increase in MS relapses as well. So it's good to find strategies in your life to reduce your overall stress levels. Surround yourself with positive people and do things that you enjoy doing. Practice self-compassion. Mindfulness-based interventions or exercises have been shown to have some benefits to the quality of life for those people living with multiple sclerosis. That was some research done in 2014. And then recently in 2019, again through an MSRA-funded study that was performed in Australia, this study showed that more than double the levels of depression and anxiety exist for people who are living with MS. And depression and anxiety have been associated with increased inflammation, with fatigue, and with disability. And depression and anxiety contribute significantly towards reducing quality of life for people with MS. The researchers studied the lifestyle factors for people with MS relating to smoking, alcohol consumption, diet and physical activity, and showed that a healthy life is very much linked to better mental health outcomes in MS. So if this is something that you feel you need to pursue or address, again, I would say check out more information on our website. We regularly run mindfulness programs by webinar, so you don't even need to leave the house to participate in a mindfulness program. Or you might want to check out some apps that you can pursue yourself. Smiling Minds, Beyond Blue, lots of places have great apps that give you some mindfulness activities. But you need to learn to manage your stress, and that might be something that you need to then actively pursue. Strongly connected to managing stress would be finding your support team. And I was really interested that in the brain health research, this was actually one of the recommendations made by this top leading researchers for people to maintain a healthy brain lifestyle, was to find their support team. You might have already done some other wellness programs. You might have watched some of our webinars. You may have heard Dr. Sally Shaw speak about being the CEO of your life with MS. Maybe you've already considered areas of life that you can reduce stress in by delegating tasks and activities. You might already have had plans and put things in place to nurture supportive relationships. But you need to actively look for your support team. Ask for support and assistance from those who are close to you, but also from those in your professional network. And where possible, always try to use healthcare professionals who specialise in MS, because they have a better understanding. There's no right or wrong with who is in your support team, but ideally, I think there is a right. You need a neurologist who understands MS, and you need a good relationship with your GP. Then there's probably another set of people who might come and go in your team. There might be your occupational therapist or your physiotherapist. It might be your connection into MS, where we are, connecting with an MS nurse advisor or a social work advisor or the employment support consultant that might be working with you. It could be your NDIS support coordinator or someone who gives you support around your My Aged Care plan. There are all sorts of people who come and go into our support team at different times in our journey, depending on what's happening at a given time. And don't feel that you can't ask for support. Coming to MS Connect and asking for advice on who should be in your support team, that can be really valuable too. Then there's the social connections that you make. Strong social connections are good for your brain. People with strong social ties are less likely to experience cognitive decline than those who are trying to function alone. A doctor from Harvard, Dr. Donovan, identified that loneliness has been shown to be as bad for your health as smoking 15 cigarettes a day or being extremely overweight. So think about who you connect with, who you have social connections with, and if that's an area where you need to increase, go for it. Look for those connections. We want you to keep on with your other medications though as well. If you have other diseases or conditions that you're managing, you need to be responsible for monitoring and managing them as well as your MS, and that includes taking your prescribed medications. Conditions such as high blood pressure, high cholesterol, heart disease, diabetes, these can all have an impact on your MS disease course. So you want to have them managed so that they're not impacting your MS. Your GP and your neurologist need to be aware of any other treatments you might be using, and that includes naturopathic and supplements, because they all combine and impact on your immunotherapy. So they need to know, so they're part of the picture. And from time to time, a pharmacy review can be really useful as well, getting the pharmacist to just check on all the things that you're taking. Another recommendation in the healthy brain lifestyle is to reorganise your life and your priorities and learn to say no. That's such a challenge. But make adjustments and be kind to yourself. Accept your own limitations and reprioritise what's important for you. Be resilient. Well, you're experiencing ups and downs all the time, but when you show flexibility in how you respond to those life challenges, you're being resilient. You're recognising your strengths and look for your supports and build on those. And work towards regaining and maintaining your goals for your family, your life and your health. You might need to adjust them, but you need to have your goals in place. So this is our summary. And again, as I said, none of it's rocket science, but you need to perhaps put some of these things into action. Do you need to have a think about your level of exercise and activity that you're involved in? Do you need to look at other activities that might help keep your brain active? Do you need to think about your weight and getting that under control, maintaining a healthy weight? Do you need to think about quitting smoking? Is alcohol consumption something that you need to consider? Is it that piece around getting other medical conditions under control and managing and maintaining your other prescribed medications? Is it around managing stress? Is it around reorganising, doing some more planning? Or is it around that team and the social connections that you have? These are all the things that we want you to think about and take on board for taking charge of, taking control of. And MS is certainly here to support you as well. We are here to be part of your team, whether it's individual support through MS Connect or through the MS Nurses Social Work Advisors, through the Employment Support Team or the NDIS team, or whether it's through programs like our peer support program, where you can connect with people either individually one-on-one for some support or through a peer support group. And those groups might be face-to-face, but they also might be by telephone. So there's groups and programs for everyone. But we want you to be active in living a brain healthy lifestyle. So they're the suggestions in a nutshell. Any questions or comments people want to make?
No questions have come through yet, Andrea, but we do invite you to type in your questions or your comments. Perhaps you'd like to let us know what you do to, you know, maybe something around your exercise or your diet program that is helpful that you'd like to share with the team.
Great. Yes.
We've got a question from Sophie. Sophie's saying she was diagnosed with relapsing remitting MS in 2011 and is currently on no medications. She has limited symptoms. She sees her neurologist regularly, and he has not put her on any regular drugs. And she's asking for your thoughts.
Yeah, Sophie, look, you'll find that research challenging because it says treatment is required early, and so this brain health research is really saying that the neurologist should be putting people on medications very early in their diagnosis, and that's not been your experience. I can't speak to your neurologist's decision making about that, but the latest evidence is showing that neurologists should be putting people on disease modifying medications early. But yeah, you have a great experience of being well despite not being on medication,
which is a great thing.
Yeah, yeah.
All right. And Melanie's asking the question about vaping. Is that just as bad as cigarettes?
I don't have a lot of understanding of vaping, but my impression is yes, it would be. I think it's an alternative to cigarettes, but I think it's still not great. So if you can wean yourself off vaping as well, yeah, that would be good.
I suppose anything that's artificial is generally not good for us in that sense. Jeanette is saying, when I don't get enough sleep, I feel tired. Should I push myself to exercise?
Oh, Jeanette, that's again a hard one to answer because it's so personalised. But I do know that there's a vicious cycle that perpetuates, that if we're not exercising, that can have a negative impact on our sleep, which has a negative impact on our fatigue. So it's really hard to know where and how to break that cycle. So there are massive benefits in trying to do a bit of exercise every day. I'm not wanting you to make yourself exhausted by exercising. That's not what the level of exercise is required. It's within your parameters. That's not a great answer, but what I would say is you're not doing any harm to your MS, or you're not aggravating your MS by exercising or by being fatigued. But ideally, we'd like you to be able to manage your fatigue so that you can get everything done in the day that you would like to do, but you're not doing any damage by pushing through that fatigue. What you'll probably find you need to do is have a rest break afterwards, because your body will tell you it needs to rest. So that's a bit of a double Dutch answer. That's not really clear, but I would be encouraging you to try and do some exercise during the day, because that might also help you sleep better, which might also help your fatigue. But it's very individualised.
Yes. Anne has just written in to say this. She tries to do 10,000 steps a day, which is getting in about 6,000. That's a great start, Anne.
It sure is.
Yeah. Anne's also mentioned that her doctor took her off injections when she got to 60, and that she has relapsing, remitting MS. And I've just typed back to ask Anne how she's feeling now since she's been off her injections.
Sometimes the neurologist will observe that the disease process has changed a little bit. It's always really hard to know, though, because the immunotherapies, in my way of thinking, are acting as an insurance policy. So it's hard to know what will happen when you stop the medications. So, but the neurologist would have a reason for having changed that.
Yeah, okay, fair enough. Robert's saying he was diagnosed in 2003 and refused medication and instead embarked on a low-fat diet, no coffee, no alcohol. He has been in clinical remission for nearly 17 years, and his neurologist classifies him as being benign MS.
That's fantastic, Robert. Yeah, fantastic. And look, there's truth in that too. No one knows what an individual's disease course is going to be. We can't make predictions on that, but this brain health research has come up with their recommendations around early treatment. But you're right, we don't know what a person's disease was going to do anyway. So you've been very fortunate, Robert, that your disease hasn't progressed. And that won't be everybody's story, but that's great. Yeah.
Robert's just mentioned he still has fatigue, but everything else seems to be fine. Jack has mentioned that.
Great, Robert, for focusing on your weight control. Yep.
Yes, absolutely. Jack's mentioned that he's had his major impact for exercise is temperature.
Yep.
So it's much easier to exercise during the winter months.
Absolutely. Jack, have you got a cooling vest or a cooling necktie? Because a lot of people over summer find that the cooling products really help, and sipping cold water really help them maintain their exercise over summer as well. And finding, it depends what your exercise is, but if it's at a gym or in a pool, cool water, air-conditioned gym.
Yeah, absolutely. And Robert's just mentioned that he's used a lot of natural medicine, and he's now has a master's in naturopathy, which is great. Well done, Robert. And also mentioned that there was no evidence that that MS gets worse or better with the injection.
Yeah.
So
I'm sorry to hear that you had another health issue, but that's also a consideration. We're not immune to other things just because we're diagnosed with MS. That can be really challenging. We've got to look after ourselves in general.
Absolutely, that's definitely so true. Holly's saying
And I'm mindful of the time as well, so just a couple more questions and we'll finish off with our final slides. Holly's saying that she's in the middle of an MS relapse, and the points about weight, anxiety, depression, stress are all relevant. And she's attempting to put some strategies in place to avoid this occurring. So well done, Holly.
Yeah, that's great, Holly.
Okay, so thank you very much for attending the webinar this morning. It's great that you were all able to make some time and spend half an hour with us. If you do have any further questions, and if we haven't gotten to your questions this morning, please call MS Connect on the 1800 number. That's free call 1800 042 138, or send through an email to msconnect@ms.org.au.